good morning, good afternoon, or good evening. Wherever you are watching from, I want you to stop what you're doing right now, because what I'm about to share with you could genuinely change the quality of every single morning you wake up for the rest of your life. I'm Doctor, and today we are talking about something that almost every senior gets completely wrong. And nobody, not your primary care doctor, not your specialist, and certainly not the mattress salesperson who sold you your bed, ever sat down and told you the full truth about. We are talking about how you sleep. Not just how long you sleep, but the exact position your body is in while you sleep. Because after the age of 60, that position is either quietly healing you or slowly destroying you. And most people have no idea which one it is for them. Here's the shocking truth that conventional medicine rarely discusses openly. A landmark study published by researchers at the University of Rochester Medical Center found that the brain's glymphatic system, that is the brain's own internal waste clearance network, think of it like a nightly cleaning crew that scrubs out toxic proteins while you rest, is up to 60% more active during sleep than when you are awake. And here is the part that changes everything. The position you sleep in directly determines how efficiently that cleaning system can do its job. After the age of 70, your brain's ability to clear a toxic protein called amyloid beta, the same protein strongly linked to Alzheimer's disease, declines significantly. And sleeping in the wrong position makes that decline happen faster. We will get to the single worst position most seniors sleep in, and I promise you, it is probably not what you expect. But first, I need to tell you something about position number 2 on our worst list that has to do with your heart. And the findings from Johns Hopkins will absolutely stun you. Stay with me. Before we dive into this list, I want to ask you something personal. Drop your age in the comments right now, whether you are 62 or 84 or anywhere in between, and tell me, do you wake up stiff, in pain, or feeling like you barely slept at all? I read every single comment on this channel personally, and your answer genuinely helps me create content that serves you better. This channel exists because of you, and I never take that for granted. Now let us go through the 4 worst sleeping positions for seniors, counting down from number 4 to the single most dangerous one. And then I will give you 4 genuinely better alternatives that are backed by science and easy to implement tonight. Starting at number 4 on our worst list, sleeping flat on your back with no support under your knees. Now I know many of you have been told your whole life that sleeping on your back is the gold standard, the proper medically correct way to sleep. And for younger adults, there is some truth to that. But here is what changes after 60. A study from the journal Spine found that adults over 65 who sleep flat on their backs without knee support experience up to 40% more lumbar compression overnight compared to properly supported sleeping positions. Think about your lower spine like a suspension bridge. When you lie completely flat, that natural inward curve in your lower back, doctors call it the lumbar lordosis, gets pulled straight and flattened against the mattress. And all night long, every disc in your lower back is bearing uneven pressure. By morning, those discs are inflamed, the surrounding muscles are in protective spasm, and the nerve roots exiting your spine have been irritated for 6 to 8 straight hours. I had a patient, Margaret, 71 years old, from Boca Raton, Florida. She had been sleeping flat on her back for 40 years. She came into my clinic complaining of sciatic pain so severe she could not walk to her mailbox without stopping twice. She had tried everything: injections, physical therapy, anti-inflammatories. When I asked about her sleep position, she looked at me like I was speaking a foreign language. We made one change. 1. We introduced a wedge pillow under her knees to restore that lumbar curve. Within 3 weeks, she told me the morning pain she had lived with for years had dropped by more than half. The science behind this is straightforward. restoring the natural curve, takes compressive load off the discs, and allows the intervertebral fluid, the shock-absorbing gel inside each disc, to redistribute properly overnight. After 65, your discs have lost up to 30% of their hydration compared to young adulthood, which means this nightly redistribution is not just helpful, it is essential. Moving to number 3 on our worst list, sleeping on your stomach. If you are a stomach sleeper and you are over 60, I need you to hear me very clearly on this. Sleeping prone, that is the medical term for face-down sleeping, forces your cervical spine, that is your neck, into a rotated position for hours at a time. Research from the American Academy of Orthopedic Surgeons shows that this rotated neck posture generates up to 3 times the normal mechanical stress on the cervical vertebrae and the discs between them. After 65, the cartilage cushioning those joints has already thinned measurably, and the muscles that support the neck, particularly the deep cervical flexors, have lost significant tone and endurance due to a process called sarcopenia, which is the age-related loss of muscle mass that accelerates dramatically after 70. But it is not just the neck. Stomach sleeping flattens the thoracic spine and compresses the rib cage, which restricts diaphragmatic breathing. Your diaphragm, think of it as the primary engine of your breathing, cannot fully descend when you are lying on it all night. This means you are taking shallower breaths throughout the night, reducing oxygen delivery to your brain and every organ in your body. A study from the Respiratory Research Journal found that seniors who sleep in positions that restrict breathing have measurably lower overnight oxygen saturation and spend less time in the deep restorative sleep stages that are responsible for cellular repair, hormone regulation, and immune function. I treated a gentleman named Harold, 77, from Scottsdale, Arizona, who had been a stomach sleeper his entire adult life. He was experiencing chronic headaches every single morning, neck stiffness that lasted until noon, and he had been told he had early signs of cervical disc degeneration. We transitioned him off his stomach using a body pillow system, and within 6 weeks, his morning headaches had resolved entirely, and his follow-up imaging showed reduced inflammatory markers in the soft tissue around his cervical spine. Now, before we get to the 2 most critical items on this list, and number 1 is going to genuinely surprise most of you, I want to take a moment to ask you something. If this video is already giving you value, would you take 2 seconds and hit that like button right now? It tells YouTube that this content matters and helps me reach more seniors who desperately need this information. And if you have not subscribed yet, please do it now and ring that bell so you never miss a video. I am uploading new health information for seniors every single week, and I never want you to miss something that could change your life. Number 2 on our worst list, sleeping on your right side. This one surprises almost everyone, and I want you to pay very close attention here because the research on this is genuinely striking. Cardiologists at Johns Hopkins have found that sleeping on the right side places the full weight of the body, often 150 to 200 pounds or more, directly onto the right lung and compresses the vena cava, which is the large vein responsible for returning deoxygenated blood back to the right side of your heart. To the right. For younger adults with strong cardiac function, the body compensates effectively. But after 65, cardiac output, the volume of blood your heart pumps per minute, has typically declined by 20 to 30% from its peak. The heart is working harder with less reserve, and adding the mechanical pressure of right side sleeping reduces its efficiency further. But there is more. The stomach sits slightly left of center in the body. When you sleep on your right side, the stomach's opening, the lower esophageal sphincter, is positioned in a way that dramatically increases acid reflux. A landmark study published in the Journal of Clinical Gastroenterology found that right side sleeping increased both the frequency and duration of acid exposure in the esophagus by over 70% compared to left side sleeping. After 65, the esophageal sphincter naturally loses some of its tone and resting pressure, which is why gastroesophageal reflux disease, GERD, is so prevalent in seniors. Sleeping on your right side is pouring gasoline on that fire every single night. I had a patient named Dorothy, 68 years old, from Nashville, Tennessee, who had been on prescription acid-suppressing medication for 11 years. Her gastroenterologist had never once asked about her sleep position. When I explained the anatomy to her and she switched to left side sleeping with the proper pillow support, she was able to work with her doctor to reduce her medication dosage within 2 months. The physiological explanation is simple. Gravity on your left side helps keep stomach contents where they belong. And now, the number one worst sleeping position for seniors, the one that is causing the most widespread silent damage, and the one that almost nobody is talking about. Sleeping in a fully reclined chair or wedge without head and neck alignment. Over the past decade, with the explosion in popularity of recliner chairs, adjustable bed bases, and sleeping wedges, an enormous number of seniors have shifted towards sleeping in semi-upright positions. And while elevation itself can be helpful for certain conditions, the problem is almost always the head and neck position. When you sleep in a standard recliner or an improperly adjusted wedge, your head falls forward, your chin drops toward your chest, and your airway is partially obstructed all night long. Research from the American Academy of Sleep Medicine found that chin-to-chest head positioning during sleep reduces airway diameter by up to 35%. In seniors with any degree of sleep-disordered breathing, and studies estimate that over 50% of adults over 65 have some form of it, most of them undiagnosed. This partial airway obstruction means your brain is being deprived of oxygen in repeated micro-episodes throughout the night. Each one of those micro-episodes activates your stress response, floods your system with cortisol, fragments your sleep architecture, and prevents you from reaching the deep, slow-wave sleep stages where human growth hormone is released, where cellular repair happens, where your immune system performs its most critical overnight maintenance work. After 75, your body's ability to reach and sustain deep sleep declines by up to 35%, even under ideal conditions. Sleeping in a poorly aligned, reclined position accelerates that decline severely. I want to tell you about Robert, 80 years old, from Portland, Oregon. Robert had been sleeping in his recliner for 3 years after his wife passed because he found it easier to get in and out of than his bed. He came to me exhausted despite sleeping 9 hours a night. His memory was declining. His blood pressure had become erratic. His cardiologist was talking about adjusting his medications. When I did a comprehensive sleep assessment, it was clear that Robert was spending almost no time in restorative deep sleep. His airway was partially obstructed every night. We worked with an occupational therapist to get him back into a properly supported bed with a cervical pillow and a knee wedge. Within 8 weeks, Robert's energy was transformed. His blood pressure readings stabilized. His daughter called me in tears to say her father was present and engaged in a way she had not seen in years. The scientific references for all the studies mentioned in this video are linked in the description below. Now let us talk about the 4 better positions you should try instead, because I never want to leave you with a problem without giving you a real solution. The first better position is left side sleeping with a pillow between your knees. This is arguably the single best sleeping position for most seniors. Left side sleeping allows gravity to assist stomach acid clearance, takes pressure off the vena cava, supports cardiac efficiency, and when you add a standard pillow or a contoured knee pillow between your legs, you restore neutral hip and spinal alignment and dramatically reduce overnight lumbar and hip compression. The second better position is back sleeping with proper knee elevation and cervical support. If back sleeping is most comfortable for you, you can make it enormously safer and more therapeutic by placing a firm wedge pillow or a folded blanket under your knees to restore lumbar curve, and by using a cervical contour pillow that cradles the natural curve of your neck rather than flattening it. This combination reduces spinal compression, supports neutral alignment, and allows the glymphatic system to perform its nightly brain cleaning work at maximum efficiency. The third better position is slightly elevated left side sleeping using a wedge. For seniors dealing with acid reflux, heart conditions, or any breathing difficulty, elevating the entire torso by 4 to 6 inches using a proper sleeping wedge while maintaining left side positioning is one of the most evidence-supported posture interventions in senior sleep medicine. Research shows this reduces nighttime reflux episodes by over 75%, improves oxygen saturation, and reduces the number of nighttime awakenings caused by both reflux discomfort and breathing disruption. The fourth better position is supported side sleeping with a full body pillow. A full body pillow running from your head to your ankles creates a complete external support structure that keeps your spine, hips, shoulders, and knees in alignment throughout the night, even as you shift positions. This is particularly valuable for seniors with hip replacement, shoulder arthritis, or spinal stenosis, because it prevents the unconscious rolling and twisting movements that cause joint compression and pain during sleep. Many of my patients over 70 describe this as the single most impactful sleep change they have ever made. I want to take a moment and speak to you directly from the heart, because I know many of you watching this have been quietly accepting morning pain, exhaustion, and foggy thinking as simply part of getting older. The world will tell you that after 70, this is just how it is, that you are supposed to feel stiff and depleted, that the energy and clarity of your younger years are simply gone. I am here to tell you that is not the whole truth. The position you sleep in tonight will determine how much inflammation your joints wake up with tomorrow. It will determine whether your brain completes its nightly detoxification cycle or accumulates more of the toxic proteins associated with cognitive decline. It will determine whether your heart works efficiently through the night or under unnecessary mechanical stress. Your body at 65, at 75, at 85 still has a magnificent capacity to heal, restore, and function at a level that preserves your independence, your joy, and your quality of life. But it needs you to make informed choices, starting with something as simple and accessible as how you position yourself tonight. It is never too late. I have seen it again and again. One change, implemented consistently, can begin shifting the trajectory of your health within weeks. You deserve that. Your family deserves the version of you that wakes up feeling restored. If this video helped you today, please share it with someone you love who is over 60. Leave your age in the comments and tell me which position you have been sleeping in. I genuinely